Dr. Erik Sanders is a pharmacologist from the Netherlands, and he has a great story about his heart. And I think it's interesting because sometimes we think doctors don't have anything wrong with them, but sometimes they too have issues. And so, Dr. Sanders, what happened to you, and how are you today?
Well, where shall I start?
What happened
Maybe,
when you were 45?
yeah, I had a heart infarction.
What is
So,
that?
so that's a heart attack. And that means that, well, there is some muscle in your heart dying,
Wow.
and your heart function goes down. And it was caused in my case because when there is too little blood flow into certain areas of the heart, that particular tissue will die. And that's because your arteries, in my case, 3 arteries were like blocked, and one like 80%, and there was a blockage after that of 100%. And on the other side of the heart, there was a blockage of 90%. They opened that with stents. So I have 3 stents in my heart already since now 18 years. So I'm now 66. And when I was in the hospital, they put in the stents. I was talking during that operation because you're not sedated or whatever. And the cardiologist, he told me I had the arteries of a 75-year-old. And that was because I had a little bit of a congenital issue with cholesterol. I didn't break cholesterol. I didn't metabolize it correctly. So my cholesterol levels were extremely high. I mean, extremely high, like 3, 4 times too high. Not like borderline too high, but really too high. And well, I didn't really know that because normally that skips a generation, this particular disease. So my father didn't have it. My grandfather died at 47, exactly the age that I got my heart attack. But so I was stented, and I got the message that I had to take medication for the rest of my life. So long story short, after about 10 years, these medication caused serious side effects. At least I took them serious, like eczema on my skin. And I basically, after 10 years, I had to change all my medication every 6 to 9 months. So I switched between the statins that I was taking. I had another drug for high cholesterol. It's called izitamine. Izitamine. It's a cholesterol reuptake inhibitor. So you make cholesterol, the liver puts it in your intestines through a channel, let's put it that way. And within your intestines, the cholesterol is put back into your bloodstream. And the second drug, so the first drug prevents that you make cholesterol, the second prevents that you take it back up into your bloodstream. So I had both of those. I had to change them every 6 months. I had an ACE inhibitor, which made me not only cough, but also gave me, I think, other type of side effects, but basically on the skin. I had to change that every 6 months. So I was really not happy. And well, you introduced us to the stem cell patches. So thank you for that, Marcy, through my wife, I can say now. And well, I was very, I was not very open to it in the beginning. I had, well, I come from a very medical / pharmaceutical background. So my father, he was a pharmacologist. He developed drugs for a profession. My mother is a medical doctor. So I was a little bit used to the concept of taking drugs when you're sick, ill, or however you want to call it. But after studying these patches and this type of, well, let's call it modality, because we're probably not allowed to say therapy. But after studying this modality as a pharmacologist, I was really intrigued and surprised that I didn't hear about it before. So I started to put these patches on, and yeah, lo and behold, my side effects went away almost after a month completely. So I was really happy about that. So I thought, oh, this is a nice add-on. But I start feeling much better because this whole stem cell story is, of course, not only working for my heart, but it's working, or for my skin, it's working basically everywhere. So I improved in a lot of areas, and I thought at a certain moment, okay, let's talk with the cardiologist and get me off the drugs, or at least try to get me off the drugs. And well, I know the person. I went to school with him. He said, no, we're not going to do that. It's against all the guidelines. I cannot do that. I would not recommend it to any patient of mine. But he said, if you really insist, he knew my background. I was more into the pharmacology than he was, probably. He just followed guidelines. And I said, well, I believe this could be something beneficial to me. So let's try it. And after 3 months, something like that, I was able to wean off all my medication. And I'm off medication. I don't know how long ago did I start with the patches, 2.5 years. So I'm off all my medication. My blood panels are good, and I'm surprised because I have this congenital cholesterol thing. It's a very difficult name, but it's called dysbeta lipoproteinuria, meaning you're not breaking your cholesterol down. So, but what happens, and I learned that, of course, through the studies, that this X39 does not only activate your stem cells to that tripeptide, the GHK copper. I'm sure Dr. Stacey will go into that, but it's also a gene modulator. And apparently it also was able to change my gene expression for that particular cholesterol pathway. So now I'm within the limits. I'm at the higher side of within the limits. I'm not like crazy low, but I don't care. It's good. Cholesterol is not bad. You need cholesterol for all kinds of other things, for your hormone production, and really for a lot of things. So I'm totally happy. And I'm, recently my internal age was measured again. Remember, they told me 75 at 47. And now I'm 66, and my internal age is now measured at about 37, 38 years old. So I'm like, I reversed my internal age, I think, by, and it makes sense. I mean, you heal with the stem cells, and after you're in a pretty good condition, you start reversing your internal age because you replace your cells with younger, healthier cells made by these better, more potent stem cells that are in your body. So that's about my story. And I know I told this story last year, so that's maybe boring for a lot of people, but I had another really interesting incident, let me put it that way. I was making I wanted to make toast, but I had the slices from the freezer, and I was trying to put a knife between those slices, and I went right into my finger, and I cut myself to the bone, really to the bone. I could see the white stuff and everything, and it was not great. But I just watched a lecture by Professor Arnold, and he's like the guru in stem cell biology and medical things. And he said, well, whenever you get a wound, don't have it stitched because you will mess up your stem cell activity. So I didn't stitch it. I put a little sellotape around it for a day. The next day, it was already completely closed. You can still see like a little scab of the cut. And after 4 days, you could not even see any. And I made photos, by the way. So if you're interested, I can send you the 4 days. It was in 4 days healed. And after 4 days, I played golf with my. It was in my pinky finger, which is the finger that has the most stress there. No pain, no side effects, no anything. And it was so. And I tell this story because that's what happens when you improve your stem cell activity. You will benefit in so much areas, and the GHK copper is really very well known for its wound healing capacities, and also not only on the outside but also on the inside. So if you have some internal issues going on that has to be healed because there are internal wounds, it will also help you heal it faster. So I became a real believer in this whole technology, which is elegant, no drugs, no nothing, no injections, stem cell related, which is, I think, well, probably the future of medicine. And yeah, so that's my story, and I'm really happy that you introduced it to us, and we're really loving these patches. And currently, I'm using the X39, the glutathione, because that's very important for inflammation in my case, and the carnosine, because of that is antioxidant, especially in heart, muscle tissue, other muscles, and for the brain. But I starting to, because of the story of Charles and Darcel, I'm starting to switch over to the X39, because basically the carnosine and the X49 are similar. The X49 is a little bit more powerful, but the carnosine has two amino acids that are also included in the AHK, the alanine and the histidyl, and there you have the lysyl. So because I believe that they are already in a, well, different chemical stage, they're probably a little bit more powerful in the X49. So I'm now using X39, X49, and glutathione as a kind of an experiment. And I will keep measuring my internal age and see if this helps me. But I would be really pleased if I got a little stronger muscle-wise and stuff without going to the gym. So that's why I try to try this protocol for the next couple of months.
Thank you so much, doctor. What a wealth of information.